Lastly, we'll talk about some adjunct therapy that we may use to help with respiratory problems. These are things such as corticosteroids, antihistamines, antimicrobials, diuretics, and oxygen. If we need an animal to breathe, let's give them more oxygen. So, this is something that many clinics may have. These are small incubators, and they may have ways to pump oxygen into them. These two up at the top, and this is a large oxygen cage. Um, it's wonderful if you have one of these, but quite often clinics don't have one like that. This is set up to probably humidify the air. The thing about oxygen, if you have ever been given oxygen, it's very drying, and so it needs to pass through water to bubble it through water, and that humidifies it and makes it a lot more comfortable to be breathing that in. In animals, we don't tend to put a little oxygen um, um, tube up their nose or anything like that. We use these cages. We may just hold our anesthesia machines have oxygen on them, and so we may just put a tube up to the animal's nose, but we don't typically put it in the nose. But we can also do something where we take an e-collar, put it on, put plastic wrap over the top of that e-collar, put the tube in a way that it keeps that oxygen in there, and then the animal is breathing more oxygen-rich air. Um, Only with the oxygen tube in there is that appropriate to put something over an animal's head that has plastic wrap on it. You're not going to make it totally airtight. You're just going to make it a smaller area for that oxygen, pure oxygen, to be in to create a higher oxygen concentration. Anyway, we have to be careful with stress because that can provide more stress or create more stress to an animal if they have something over their face. Um, so this is the ideal situation, putting them in a cage that is oxygen rich, but sometimes we have to be a little creative in doing that. So steroids. We've talked about steroids back in the anti-inflammatory section. We may use them for certain respiratory conditions short term. Things like where we don't have an infection going on, that's the best use, right? Because steroids have the side effect of suppressing the immune system. So that's the danger in using them. If something's going to progress to being an infection and we're suppressing the immune system, that's not a great situation. So things like allergies, smoke inhalation, bronchitis, feline asthma, if they are breathing in chemicals for some reason. And when I say chemicals, it can be something as simple as um, ammonia damage. So people that hoard animals, that you have probably heard of cat hoarders in particular, where the Humane Society may go responding to a neighbor calling them because they're worried about animals that a person may be hoarding and keeping in a confined space. Cats in particular, if they're kept in a confined space, let's say a garage, and you have a ton of cats in the garage, and they're urinating, and the owner is not cleaning all of that up, ammonia is created. The animals breathe in the ammonia. This can happen in dogs as well as cats, and they can get very damaged lungs. And so steroids can help to stabilize the cells and stabilize that inflammatory result, but we would only use it in the short term because of long-term effects of steroids. So the drugs that we may use are prednisone as an oral drug, and then we can have inhalers, beclomethasone and triamcinolone, and these can also be used as rescue inhalers as well to actually breathe it in to help in situations of asthma. So the risks, if you don't remember the risks, go back to chapter 13 and review them. Antihistamines are used sometime. They seem to not be that much of a factor in animal allergic respiratory problems. They may help a little bit with feline asthma. Uh, Histamine. So histamine comes particularly from mast cells in response to some kind of inhaled allergen. And we may use this. I want to just point out that sometimes we use antihistamines for things like feline asthma so that if we are using steroids, we can use less of the steroids. It may help with that if we find the right antihistamine that seems to work. We can use this uh, antihistamines also for recurrent airway obstruction. And I called it before COPD. And another term that's used for this condition in horses is heaves. It kind of describes what happens. The horse actually has to heave to basically expire air, carbon dioxide basically. They can breathe in okay, but they are really pushing the air out, and it creates what's called a heave line in their on the sides of their abdomen. It increases those muscles because they have to push the air out. It is basically a disease where the horse is exposed to dust from dirt, hay, molds that are in that hay. So, one of the things that you do is you don't store the hay near the animal. Sometimes you wet down hay and feed it and not on the ground. So, you want to keep them away from dust and mold and things like that. And the wetting hay down then creates less of that dust that they're going to breathe in. So we try to control what we can in their environment, and and then we may treat them with antihistamines. We can also treat things like insect bites and vaccine reactions with Benadryl. That's a very common thing to use it for. That is not quite in the respiratory area, but some of these things can progress to respiratory problems. So the thing about antihistamines is they are best used if they get there before the histamine does. And we can't always predict that, right? But some conditions where owners know that an animal is seasonally allergic to something, they may go ahead and put this in the feed in the case of horses, or it may be used as a treatment before an animal is given a vaccine if they've had a vaccine reaction before. It can be used after you get a vaccine reaction. I'm not saying it can't be, but the main thinking is if it gets there and blocks those H1 receptors, then we're golden, right? So it may take a little more time to take effect when we're giving it after the histamine has been released. So antibiotics. Antibiotics are definitely called for in cases where we think something has progressed to an infection caused by bacteria or other microorganisms. Not effective when we're using it with a viral infection. And very typically, large animals that are outside and exposed to more bacteria it may be our first choice in treating a respiratory problem, a respiratory infection. With small animals, we probably want to do more testing before we're going to reach for it. But just like you and I may go to the doctor and the doctor has listened to our lungs and has decided, you know what, you started out with a cold, but I think this has progressed to pneumonia or a respiratory infection. And I'm going to treat you with something, and I'm going to reach for the thing that is most likely causing the problem. And the doctor, in the case of human medicine, has the experience, the veterinarian has the experience. They know the likely suspect. They're going to reach for the likely thing. But we really should be confirming when we can, and this is an expense that the owner has to bear. And so, usually, in the case of food animals, they are not going to go for this type of these type of diagnostics. They might do it on one animal in a herd if they have a herd that has an infection. Um, but they don't tend to do as many diagnostics as do, say, horse owners or dog and cat owners. So the thing that we can do is get a sample um, of the secretions in the lungs, and we can get this with what's called a transtracheal wash or bronchoalveolar lavage, and it's simply getting down into the lungs to get the appropriate sample that then we can culture. It's not useful to stick a swab up an animal's nose because they're breathing in all kinds of stuff. And so the chances are you're not going to get the culprit. You need to get further down in there. I'll explain these methods in a minute of getting that sample. But the other thing that we need to do when we give antimicrobials, and this is our next section, so we're going to get into this in more depth, but basically we need to treat for the appropriate amount of time and impress upon the owner that they need to give the full amount of antibiotics. Some of our thoughts on this have changed a little bit, so don't memorize this particular information here, except that when we have a chronic condition, we do typically want to treat at least 1 week beyond resolution of clinical signs. But we have some other ideas in just length of treatment that I'll get to in the next chapter. Sometimes we can nebulize animals with an antimicrobial as well. So transtracheal wash procedure, this is simply collecting a sample from in the lungs. We introduce a cannula into the trachea. So a cannula is simply a tube that keeps a hole open in an animal. And then we thread a tube into the lungs. And this is a kind of close up. We're going down into the trachea, into the bronchi, and then we're going to, on the other end of this little tube, is going to be a syringe with some saline. We're going to introduce a small amount of liquid in there that then we will pull back up with that syringe. And that syringe, the fluid coming back up is our sample. And we submit that to a lab, and they can do a culture and sensitivity and determine what bacteria is causing the problem. And that's the best thing because we don't want to use antibiotics that are not going to be the appropriate ones. It creates resistance. This is a concept, again, we're going to talk about in the next chapter, but um, we would like to take samples to determine if we're treating with the appropriate antibiotic. Lastly, diuretics. We talked about diuretics in the cardiac section. So when we have pulmonary edema, and this can be from congestive heart failure, as we talked about, or even pneumonia, we want to get rid of that extra fluid in the lungs. The problem that can occur if we get a little too overzealous with this kind of treatment is we can dry out the mucous membranes, make that sticky mucus, and then we have to add a mucolytic or something like that. So we want to be careful with this. A little bit might be just the thing and not going overboard in treating with diuretics.